as the support and education chairperson. So tonight we have Dr. Touma that is with us, as well as Nathalie, who are here for our webinar. I just want to take a moment to mention a few upcoming events before we begin. Our annual Lupus Walk will be on August the 20th. Again, this year it is a virtual walk. And we ask, if you haven't registered as yet, to go online and register. You can start your own team, or you can join an existing team. Any questions, please contact the Lupus Ontario office for assistance if you need some assistance. Tonight, we also have with us Linda Keel, our president. Linda, it's good to have you here with us tonight. So tonight, just so you know, the webinar is being recorded for your own privacy, and it will be available for you to view in the next 48 to 72 hours, as well as Nathalie and Dr. Touma will be forwarding the presentation, and we'll have that also uploaded online for your viewing for additional information. So tonight, we are so happy to have with us Dr. Touma, who is the new director. For those of you who don't know, he's the director at the Lupus Clinic in Toronto, or for the UHN network. So Dr. Touma, it's such a pleasure to have you. And as well, we're joined by Nathalie tonight, who is the clinical nurse specialist at the Lupus Clinic in Toronto. So many of you who are here who does go to the clinic will recognize these two faces. And it's an honor to have you both. You do such amazing work at the Lupus Clinic. I'm a bit biased because I am a patient at the Lupus Clinic, has always been a patient at the Lupus Clinic, and I feel very special because we have amazing care. For those of you who are not at the clinic, we do get information that's always posted online as well. But you have to be at the clinic to be able to use the amazing service that these two amazing guests of ours have tonight. So without further ado, I would like to introduce Dr. Touma, who will give a brief introduction of himself, and then Nathalie will do that, and then they'll begin the presentation. So again, thank you and welcome everyone to Lupus Ontario's webinar.
Thank you. Can you hear me well?
Mm-hmm.
Yes. Okay, great. Well, good evening, everyone. And thank you again, Linda, Sandra, and everyone behind the scene who prepared for this event. We really appreciate that you're inviting us again to be here with you tonight. So I'm just going to keep it very short. I'm a rheumatologist, the director at the Lupus Clinic, and my work is mainly focused on lupus. We do a lot of clinical work as well, research at the clinic. And I'm very happy today to have with us Nathalie, who is our specialist lupus nurse. Nathalie, you want to say a word before we start?
Sure. Hi, everyone. I'm noticing some familiar names in the chat, so it's nice to see everyone. And I echo Dr. Touma's thank you to Sandra and the whole team at Lupus Ontario for organizing this. For those of you who don't know me, I am the lupus nurse specialist over at Toronto Western Hospital in rheumatology. And I work with Dr. Touma and some other familiar names, Dr. Daphne Gladman. So happy to be here today and looking forward to this discussion.
Okay, let me share the slide just to make sure. Are you able to see the slides? We're good?
Yes,
okay,
we are
great.
Good. I just want to, yes. We should also make a note that if you have any questions as we go along, we'll try and answer them the best we can. We've kind of divided the presentation into a few different sections. So we'll answer questions after each section as we go along. So do you want me to start?
Yes, please go over.
All right. So today, as you guys know, we're going to be talking about COVID treatment and vaccination frequency in our immune compromised patients. So today's objectives, just very briefly, we'll go through COVID-19 and lupus. So which patients from our lupus group are going to be more affected by COVID? And we'll also go through the vaccine. Should we have 1, 2, 3, or 4? Which of our lupus patients are going to respond better to the vaccine? And if you've already had COVID, do you need the vaccine? This is a question we get asked a lot. We will also be talking about Paxlovid. So this is the medication that we're using currently to treat COVID in our immune compromised group. So we'll talk a little bit about where we can get the medication, do you qualify for it, etc. We will also very briefly, and I'll actually just talk about it now quickly. Unfortunately, I don't have much to say about it for now, but Evusheld. So is this available for lupus patients? I'm getting this question a lot in my email. Unfortunately, it's not. For those of you who don't know what Evusheld is, I will go through it very quickly. It is a monoclonal antibody used for the prophylactic treatment of COVID, meaning that it's used to help prevent COVID. It's made up of 2 antibodies, and I may say them terribly, but it's tixagivimab and silgivimab. And for the time being, like I said, unfortunately, the lupus group can't get it. They're using it at the hospital mainly for those who have cancer or who have had a recent transplant. It's given as 2 intramuscular injections. If you are a lupus patient and you have had a transplant and you're interested in the drug, then I would reach out to the transplant team who's in charge of your care at the hospital if you would like Evusheld. So moving on, we'll talk about long COVID and rheumatology. And then lastly, safety of the COVID vaccine in lupus patients. So I think Dr. Touma is going to take over for a little bit. And away we go.
And again, as a reminder, please, if you have any urgent question, you can put it in the chat, or we're going to stop. As you can see here, we have 6 quick parts in the presentation. So we're going to make sure to stop every time and ask if you have an urgent question. Okay,
Dr. Touma, can I just interrupt you for a moment? Just to make it easy and not get kind of mixed up with the comments and stuff in the chat, if you could please type any relevant questions for Dr. Touma or Nathalie in the Q&A, that will make it easier to go through. So please type any questions in the Q&A. Thank you, Dr. Touma. Continue, please.
Thank you. So let's move to our first part, which is what happens really when lupus patients get the vaccine. And as you know, the aim when we get the vaccine is that our immune system will develop antibodies, and you need these antibodies to prevent you from COVID and other infections, right? So this is actually a study that was presented at the American College of Rheumatology. And as you can see here, they assessed the production of antibodies in patients with different immune disease, not just only lupus, patient with Crohn's, if you've heard about it, rheumatoid arthritis, spondyloarthritis, different type of vasculitis, because this question is relevant for all patients with immune diseases getting immunosuppressant. So what they did in this study, they gave the vaccine and they measured the antibody production. And at the same time, they have healthy people who are not on immunocompromised, like methotrexate, Imuran, azathioprine, other medication. And let me share with you some of the results. So you can see here, I'm going to explain this complex slide, but bottom line, what is it saying here? That majority of patients who are on immunosuppressant medication like methotrexate and azathioprine and Salsab, they did have actually lower antibody production compared to people who are not on immunosuppressant. And the difference is almost 3.4-fold time. So if you're not on any medication, you will have 3.4 more time antibodies. And this is, again, I'm setting the stage here to talk later on about the necessity of repeating these vaccines. And this is how we start learning from emerging data that patients with lupus, they need more than one single vaccine because their immune system is not giving them good protection. Again, often because of the immune disease itself, lupus, and 2, because you are on immunosuppressant. Now, if you're asking me how is different if I'm on methotrexate, azathioprine, or Salsab, and this is the answer. Look at this. If you're taking Salsab or Myfortic, some of you know the difference. They're almost, very similar, just different names. And compared to healthy people will have 21-fold time higher chances than you to develop antibodies. So you can see how it's the effect, the results of this specific treatment on antibody production. If you're taking methotrexate, it will also lower this by 4.4. If you're taking Imuran or azathioprine, it's almost the same, 3.5. So look at the difference here. Myfortic and Salsap significantly will lower the antibody production, less with methotrexate, less with AZA compared to healthy controls. And if you're taking any of different medication which suppress the B lymphocytes, I'm gonna explain what is this. So maybe some of you have been on something called rituximab or Baptera. So this medication will significantly lower the antibody production, 57-fold. So even way more than Salsap and Myfortic. And for other people, if we have here in the audience people who are rheumatoid arthritis or inflammatory bowel disease, and they're taking something like Humira, Enbrel, Simponi, all these medication will lower it, but you can see 2.6. So they do lower it, but less compared to the medication that lupus patients take. And what we have learned from this as well, particularly for people who would receive rituximab, we should give it before we give the patient rituximab to allow their immune system to produce antibody. And if it happens that you take rituximab, we have to wait at least 4 or 5 months, then give you the vaccine. Because if you give it earlier, right away after rituximab, your immune system has no B lymphocytes and you will not produce any antibody. So you will not benefit of the vaccine. Now, the major question for lupus patient is prednisone, glucocorticoids. And you're wondering, how does it affect? Does it affect at all? The answer, yes, and big time. And look at this. Not only it affects any dose, literally 5 milligrams or greater, it will affect. And even in patients who were on less than 5 milligrams, it affects the antibody production. So really, any dose of prednisone, it will lower your immune system from benefiting from the vaccine. So in summary, all immunosuppressant medication, methotrexate, azathioprine, Myfortic and Salsap, rituximab, and prednisone any dose will lower your immune system to benefit from the vaccine. This is why we recommend not only single vaccine, we keep recommending these, and now we got almost to number 4 in these vaccines. I think before moving forward here, I will stop and just check if there is any urgent question from the team.
There's a few here, Zahi. I see 3. So Kathy Farron is asking, after having massive reactions to the first 2 vaccines, both requiring an emergency visit, how can she safely receive the 3rd and 4th boosters?
Yeah, this is very challenging. In this case, I would not recommend it. You have to definitely be working with the allergy clinic and seeing specialists to see what are the issues, and if you are even if it's safe for you to get more vaccines. Nathalie, do you want to add something on this?
Yeah, I was going to say, Kathy, if you want to potentially email me separately, and we can kind of talk about what your actual reactions were and how we can figure out if you could receive the 3rd and 4th boosters safely. I'm happy to do that. The lupus.nurse@uhn.ca. I have another patient. Why do some lupus patients get super sick from the vaccine and others don't? It makes me very sick for up to a week, and then my lupus takes another week to calm down.
A very important question. I have toward the end some slide about how people are reacting when they have vaccine. You know, simply, I'm going to answer it quickly now, but we'll get back to this. Any vaccine can give you adverse event. And we know this with the flu. Some people will develop fever, joint pain, and ache. Now, why you particularly getting more symptoms? I don't have an answer. It depends on your immune system and how your immune system is reacting to this vaccine. Really, there is no way for us to know ahead of time how each patient or each person will react. But if you have very bad symptoms, I'm just wondering, maybe some pre-medication, Tylenol prior, or even if it's triggering lupus flare, we have to deal with the lupus flare. But I'm going to cover this toward the end.
Yes. Heidi Charles is asking, does Plaquenil affect the vaccine?
Very good question. No, it doesn't, because as you know, Plaquenil, it doesn't lower your immune system, while all other medication, as you can see on the slide, they do.
Okay, I have 2 more questions, and then I think we'll keep going and we can answer the rest a little later. Jan is saying that she takes methotrexate every day. How does she get her booster? And basically, is it safe to get the booster? So absolutely safe to get the booster, Jan. Are we stopping methotrexate before giving booster?
You know, initially, when we started this probably 2 years ago, people were holding methotrexate, Imuran, and Salsap for a week. but I can tell you there is no strong evidence about it. So the American College of Rheumatology and the Canadian, we have recommended that we should stop it for a week to allow your immune system to give you better reaction and production of antibodies. But if you don't stop it, it's not a problem, because in some patients, we don't want to risk allowing the lupus to be more active, then it defeats the purpose. Okay.
Right. Yes, and that actually answers another question as well. So perfect. And then the last question from Kirsty, she's not taking any immunosuppressant drugs. She's had 3 COVID-19 vaccinations and would like the 4th dose. Is that okay? I would say that's absolutely okay. You don't necessarily have to be on immunosuppressant drugs to receive the vaccine. My understanding is that you can be immune compromised. So having lupus means you are already immune compromised. So I think if you go to clinic and you show them that you have lupus, they should give you the vaccine. It should not be an issue.
Great. So bottom line here, the conclusion.
To interrupt one moment, just to follow up on Jen's question, she actually gave the wrong.
I saw that. So she takes dexamethasone, not
medication. She's oxide.
Yeah.
So, I mean, dexamethasone is a steroid. I don't see any reason why she shouldn't get the booster.
Exactly. Absolutely.
Yeah,
and
perfect.
even as you said, Nathalie, even if you're not on any medication for lupus, the fact that you have lupus, we know it's a disease at the level of the immune system, so you should be eligible. So in conclusion, as you said, and you've heard from me and Nathalie, it is safe for lupus patients. We should get the vaccine. And actually our clinic, based on the recommendation of the American College and the Canadian, we do recommend the vaccine, and we've reached almost number 4 at this level. So let's move now a little bit and talk about this study. Probably you're all wondering what would happen for lupus patients when they get COVID. So this is one of the study that was collecting online data from all around the world. And you can see here, they analyzed almost 2,000 patients, and as expected, the majority, 90% were female, mean age 44. And some of these patients end up being in hospital. But among those who are in hospital, some of them did not use oxygen and some of them did. And unfortunately, there were also some deaths. And I'm going to share with you here, you're wondering which patient is the one that might get more complication from COVID. So based on this international data, this is what they found. And I think some of it makes sense. The older we are, our immune system might not protect us so good. So it's higher chances that we might run into trouble if we get COVID as well. Male lupus patients, they're usually also a risk factor. And we know this because always lupus male patients, they do have worse disease in general. We saw as well patients from outside Europe, which speaks again here for patients of different ethnicities, minorities, they're higher risk to get into trouble if they get COVID as well. Not a surprise, patient on prednisone. And again, any dose of prednisone, the more you're taking prednisone, the higher chance you're gonna run into trouble with COVID. People who did have also kidney disease, or if they have heart problem, or if they have multiple problem medical like diabetes, hypertension, the more you have problem, the higher chances we're gonna end up in hospital and maybe developing complication. So in conclusion, more severe COVID symptoms or outcome happen in people who do have a lot of diseases in addition to lupus, older age, people who are on steroid, and taking also immunosuppressant. So in summary, to the two sections that we have presented so far, most immunocompromised, including lupus, particularly here, the focus patient, will have poor response to COVID vaccine, the first one. This is why we should continue and get the second, the third, and the fourth. And if you are an immunosuppressant, any immunosuppressant and prednisone, it will lower your chances of developing antibodies. So get yourself ready and get all the vaccines. Nathalie.
Yes. All right. I don't see any. We have one question, just quick, Zahi.
Okay. Yes.
Anna Fonseca is asking if the study included patients with active lupus and those who were in remission.
I'm trying to find where. Can you repeat the question? Oh, I see it. Does the study include patient with active lupus and patient in remission? Yes, it did. And we know actually if the patient are active, if the lupus is active, unfortunately, the chances of having problem is higher because when your lupus is active, we call it sometimes your immune system is on fire or there's a storm. So your immune system is producing a lot of antibodies, but as you know already in lupus, those antibodies go and fight different organs. Goes to the skin, gives you a rash, goes to the kidneys, affect the kidney function. So if your immune system is on fire and you're getting infection on top of this, so definitely it's a problem. Talk to your rheumatologist right away and your family doctor.
All right. Okay, we're going to keep going and we'll just keep answering questions as we go along. So right now we'll start to go over Paxlovid. So I'm sure all of you know what Paxlovid is. You guys all do your research, but it is the medication we're using to treat those who are immune compromised and who have COVID. So Paxlovid is 2 antiviral medications that when we give them together, they help stop the actual coronavirus from multiplying. So it helps your body overcome the infection a lot faster and in a more safer way. So Paxlovid is made up of 2 antivirals, Nirmatrelvir and Ritonavir. You need to definitely meet a criteria for Paxlovid. When I've called in a prescription, the first thing the pharmacist asks me is, do they have a positive COVID test? And that's either on a PCR test where you've gone like to a COVID treatment center and they've done the nasopharyngeal swab and they've sent it off and we can see the result. And I've had to actually fax it over to the pharmacy to show that. Or you've done a rapid antigen test at home that came back positive. And then, of course, you must be at increased risk of progression to a more serious COVID-19 disease. So like we've just covered, if you're immune compromised, you are likely to have a more worse COVID infection than the general population. So that's how you get Paxlovid, and we can prescribe it. Your family doctor should be able to prescribe this. And I will show you here, where do you get it? So like I just said, it's available at many different pharmacies. However, your particular pharmacy may or may not have it. They all kind of carry little stock. So I know like last week I called probably 3 or 4 pharmacies to see where I could get it. But you're also able to get it at the COVID-19 treatment centers. And I've listed both of the links below. So the first one is going to show you which pharmacies will carry the medication, even if it's not your own. And then the second one will show you the assessment or treatment sites that are close to you that carry it just by you entering in your postal code. A quick note, because I've been getting this question a lot as well. Paxlovid is not the drug used for prophylaxis, meaning preventing the COVID-19 infection. Like I just said, you can only get the drug if you've proven that you have COVID-19, either by the PCR or the RAT test. Like I spoke about a little while ago, Evusheld is the medication that we're using for prophylaxis, but we don't have access to it quite yet. And last but not least, I have also been getting a lot of requests. Can I get Paxlovid and just have it like in case I get COVID? I wish I could do that, but unfortunately we can't. I think there's just not enough drug to go around. And Zahi, do you want to go to the next slide?
Just I want to say here quickly, again, Paxlovid, think about antibiotics when we have an infection. So we use this medication, it's antiviral to fight the infection. It's not a prophylactic.
And we should say also, should every lupus patient who gets COVID take Paxlovid? Not necessarily. I think we've kind of come to the conclusion that it's very case-based. So I would say if your symptoms are quite mild, like just a bit of a cough, a sore throat, then maybe taking Paxlovid really isn't that big of a deal. Whereas if you have like the full-on fever, loss of taste, smell, et cetera, and so forth, giving Paxlovid is probably good. So we really sort of prescribe it on a case-based situation. So basically how you take it, it's taken for 5 days. It is a complicated medication in that there are like 20 different medications that you are not supposed to take if you are taking Paxlovid. So make sure whoever prescribes it for you, you tell them what you are taking and they know exactly what you're taking. But some of the common ones that I've seen that a lot of lupus patients are on are rivaroxaban or Xarelto, which is a blood thinner. If you have antiphospholipid syndrome, a lot of patients are on that. Colchicine and sildenafil, which is used a lot for pulmonary hypertension. So maybe not many of you on that, but that's definitely contraindicated. And the pharmacists are very, very good about this. So I've had them call me and say, listen, your patient is taking this, this, and this. I'm going to make sure that they half the dose of that medication for the 5 days while they are taking the Paxlovid. So if we prescribe Paxlovid to you and the pharmacist gives you direct instructions on how to use it, that's totally correct. Do what they say. So it comes as a blister pack. You take 2 pink tablets and then a white tablet twice daily for 5 days. Side effects very quickly. You can get altered sense of taste, diarrhea, muscle pain, vomiting, high blood pressure, headache. It is a new medication. So of course they have to say there could be some serious or unexpected side effects. So if you're taking it and you just notice something unusual, let your physician know right away.
Right. And I want to add here quickly as well, sildenafil, sometimes we use it for patients with Raynaud's when the color of the finger change in the cold exposure. At the same time, also, patients who are active with very active lupus, and if they are on high dose of prednisone, even if your symptoms are not very severe, I think it would be important to review this with your family physician and your lupus doctor, because you might be eligible for this medication even though you don't have a lot of symptoms. If you don't have a lot of symptoms, again, because you are on a lot of prednisone and your immune system is already very active because of the lupus activity. Nathalie, I think there is a question there. I'm going to read it for you.
Sure, go ahead.
So Nathalie, if we test positive, can we email you at the lupus clinic to get a prescription? I'm a patient at the Western Clinic. Go ahead.
Yes. Email me, of course. Either email or call. Let us know. You can also email our admins and they forward the emails on to me. And give us your pharmacy information and we'll figure out how to get it for you. Yes.
Okay.
All right. Anyone else before?
I think they're just asking about the email of the clinic, and we can share it, Nathalie, later on. Right?
Should I give it away? It's lupus, guys. So lupus.nurse@uhn.ca. And you're welcome to email me. But don't email me between July 15th and the 25th because I am away. So I will not respond, but I'll get back to you when I return. Okay. Do we have another question just before we keep going? Yes. Thank you for posting that. Okay.
No, I don't see question. So we're going to shift gear and now talk about something maybe you've heard about it, which is important, the long COVID symptoms. Okay. And some of these long COVID symptoms, they cross over with rheumatology, and some of it looks like lupus. Nathalie, do you want to take us over this?
Yeah, so like it's listed here, sometimes it's really hard to sort of see the difference between, I would say, what they're calling long COVID and like a lupus flare, essentially. Like we have listed here, you could see joint pain, you could see muscle pain, fatigue. I mean, these are all very common symptoms of lupus, so hard to decipher. Within your lungs, difficulty breathing. I think that's more if you've had really bad COVID symptoms. I think they've noticed that some patients end up with a little bit of fibrosis or scarring on the lungs, and this could cause, I guess, the long COVID shortness of breath. And then kidneys, high blood pressure, leg swelling. I mean, again, very common in our lupus nephritis patients or the lupus patients who have kidney issues associated. So, and then rheumatic diseases, so lupus, et cetera, and so forth. So, I mean, I don't know, Zahi, do you have anything to add on this in terms of long COVID?
No, actually, again, here, what I want to say is that don't panic if some of these symptoms happen right away after you develop COVID. Remember, it's just not just only with COVID. All of us, when we have a viral illness, sometimes we feel back pain, pain in the muscle, the joints hurt. So give it a few days. And if things resolve by itself or with minimal medication, then you don't need to change a lot of things. It's going to need time until your immune system fight the virus infection.
Yeah. And I will say, like, I've noticed this in a lot of our patients who have had COVID. They'll call me a little bit later after their symptoms have resolved and they're starting to feel normal again. And they'll say, you know, I am actually experiencing a bit of joint pain or a bit of muscle pain. It just kind of feels like my lupus is flaring. So I've noticed that this is kind of common after the COVID vaccine. And a lot of times, to be honest with you, we don't end up treating it and it goes away. I think it's just like post-viral symptoms of COVID. So don't be alarmed and always feel free to reach out to us if that is the case. So moving on, like we mentioned already, so any non-drug approaches to help treat long COVID, you know, keep yourself hydrated, joint protection, splinting if you need to. If you have any questions around splinting, you can always reach out to the Arthritis Society, or I can always send a referral on there for you, and you can see physiotherapy or occupational therapy, and they'll help you with splinting. And then heat and cold applications, any massage therapy, keeping your good physical activity, these are all things we recommend with lupus anyways. And if you are experiencing swollen joints and they're very painful, of course, reach out to us. Use of medications, Tylenol, NSAIDs. But of course, if your symptoms persist, try and speak to us about it, and try and stay away from Advil. We always ask if possible.
And remember here, we're talking about not what you develop right away after the infection, if the symptoms persist. And please, this is very important, what you've heard from Nathalie. Especially patient, if you have lupus nephritis, you cannot take any inflammatory medication, Advil, Aleve, Motrin, anything on the market, on the shelf, you cannot take this. It will kill the kidney. Don't do it, please. And if you don't have any problem and you want to take NSAID, again, be careful if you're taking any anticoagulation. A lot of lupus patients, because of the phospholipid or blood clot, Xarelto, aspirin, something else. So with NSAID, it will increase the risk of bleeding. And often people, I don't know why, they take it on an empty stomach before going to bed if they want to take NSAIDs. I mean, this is just recipe for bleeding. Don't do this. If you ever want to take Aleve or any of these medication once in a while, don't take it on an empty stomach, okay? And if it's bothering you, talk to your family doctor or to us, and you will get protection pills to protect the stomach.
Yeah, and I know sometimes there's confusion around what is an NSAID and what isn't. So feel free to reach out to us if you have any questions regarding the safety of a medication. All right, so if there's do we have any further questions in the Q&A? Shall I keep going?
Let's continue. I don't see any questions so far, unless if I missed something. So we prepared here some of the common questions that you might ask. Go ahead.
Quick question. This is a good one for you. Why stay away from Advil?
Oh, why stay away? Okay, very good question. Advil, don't get me wrong, it's a good medication, but you need to know that Advil is not just Tylenol. It's an anti-inflammatory medication, and unfortunately, it has side effects. So you need to monitor your blood pressure. And if you take Advil for a long time, we know there are studies showing, first of all, it increases your risk of blood clotting. So you have to be careful with this. And also, even if you don't have lupus nephritis, it can cause something called interstitial nephritis, which is a different type of inflammation in your kidney. And with time, chronic use of anti-inflammatory, you might affect your kidney function. Okay, so this is why, yes, you can use them, but carefully. And if you have lupus nephritis, you cannot use them. Absolute contraindication.
All right. I hope that answered your question, June. So we'll just go to the frequently asked questions related to the COVID vaccine. And if you guys have any more that we missed, I'm happy for you to put them in the chat or the Q&A. So the first question, if I get COVID-19 symptoms or I test positive for COVID, do I need a vaccine? So definitely yes. The immunity after a COVID illness may not protect you for a long period of time. And we also know now that there's so many different strains of the COVID infection, and we've seen lots of patients get it more than once. So definitely get your vaccine regardless of whether or not you've had COVID. Is COVID-19 vaccine safe during pregnancy? So yes, definitely. And we know there's been lots of studies now that it is. Of course, always check with your OB. I think I swear I was the guinea pig for COVID vaccine in pregnancy. I got the first one when I was 38 weeks pregnant. I did also check with my OB before I got the okay to get the vaccine. Should know, I guess, this is kind of interesting because I was 38 weeks and very close to labor. They asked me to, rather than wait, what is it, 2 weeks before you get the second dose or the 14 days? Basically, they asked me to wait because a lot of patients were experiencing fever getting the second dose of the vaccine. And they weren't sure if this could be, how would they know if this was related to an infection or something wrong in labor, or if it was related to the vaccine? So they asked us to wait. I think it's probably safe now. You can just go ahead, but just in case, learn from me and check with your OP. What should I do if I get COVID-19 illness and I have not received the vaccine? So like we said, immune-compromised patients can be prescribed Paxlovid or the Evusheld if you can get your hands on it. And can the vaccine cause a lupus flare? Yes, but it's not very common. And we'll look at this a little bit later on in our discussion. Do you have anything to add, Zahi?
No, just a quick question I see here from Annette. She's asking if Tylenol is better than Advil. I would say it is safer, actually, yes. And Tylenol, you can take 2 tablets at up to 6 tablets a day, as long as you space them by 6 hours, okay? But make sure if you take Tylenol, don't take after Tylenol right away Advil, because this is too much for the liver to support, okay? It is, unfortunately, Advil work, all the anti-inflammatory, the NSAIDs, they're stronger. They work better for certain type of pain, particularly in people with osteoarthritis. Again, being a lupus patient, it doesn't protect us from having other medical problem. And majority of people, they're gonna get osteoarthritis, hips and knees pain. And we know that NSAIDs, they do work better for the hips and knees pain and the back pain. But again, you gotta be careful with moderation. I mean, if you have a trip once in a while or every week or 2 weeks, maybe you can take Advil before your trip, but otherwise try to rely, if you can, more on Tylenol. It's safer. That's the whole story.
Or Voltaren topical.
Yeah, exactly. Just yeah. I have nothing to add here, Nathalie. Let's move on and continue.
Yeah.
So I think the last question here, and somebody already asked us about the safety of the vaccine in terms of adverse event. What would happen if I take the vaccine? So this is actually a nice study published by a French group, but it's an international study, and the survey was online, and any patient with lupus was able to participate. So as you can see here, they included almost 700 patients with lupus, and they did receive different type of vaccine. Pfizer, Sinovac, again, we don't have Sinovac in Canada, but this is because it's an international study. AstraZeneca and Moderna. You will see the number different than what we have in Canada. Again, this is an old study. It's almost now a year ago, at least. But this is what they took at that time. And you can see that the rate of flare from lupus is really low, 3%, okay? Because again, the symptoms, the common symptoms that we all might experience is sometimes a little bit, maybe low fever, maybe joint pain, headache, muscle aches and pain for 24 or 48 hours. But this is not a lupus flare. Lupus flare were only 3%. And if you're wondering what were the lupus flare that happened, again, some people here, just if you follow with me, among those 3%, the top symptoms was fever, and it persisted more than expected. Some people did have some flare with the skin and other with their joints. Some people did have pericarditis or pleuritis, which is the pleuritic chest pain. When you take deep breath, it hurts around the heart or the lungs. And other symptoms as well, kidney and neuropsychiatric and so on. Fatigue, definitely. And now, if you're wondering, did any of these people who experience the flare end up with going to the ER or not? Again, you can see here the number is really low. And people who got admitted from a flare after a vaccine is less than 1%. Now, let me tell you one thing here. The challenge always here is the attribution. What does it mean? It means simply when we take the vaccine, did it happen by chance that our lupus is gonna flare, or it flared because of the vaccine? And this is more common applicable for people who are recently diagnosed with lupus, or if their lupus is still very active within the first 20, 30 years. because this is when we keep having flare after flare. So this is why the attribution here is difficult to know whether this is a lupus flare that it was going to happen regardless whether you get a vaccine or not, or if it could have been vaccine related. But the assuring part, again, that the number is very small, less than 3%, and the outcome in general were okay. And in those people who did the flare, reach out to the rheumatologist, and they can manage maybe by increasing a little bit the prednisone or giving you a short course of prednisone to make the symptoms go away. Or if it's a skin rash, probably you can use something local to help you with the symptoms. So in summary, in conclusion, this study, the VACOLUP, showed that the risk of flare after COVID vaccine, really it's very low. And patients with lupus, they were able to tolerate the vaccine in general without running into major problem. And this is, again, included mainly mRNA vaccine. I want to just tell you something, that the flu vaccine, the new now technology, it's coming as well. There are research and ongoing trials for flu vaccine mRNA. So you can see this mRNA is the future, and it's gonna maybe down the road replace all our old-fashioned vaccines, because this is a more efficient way to develop vaccines. And the immune reaction is immune response is better with the mRNA vaccines. Oh, that was actually our last slide here. So let me stop sharing, and we have plenty of time for your questions.
I just want to answer one that we got. Anna is asking, she's got both lupus and antiphospholipid, so she thinks she's not able to take Paxlovid. And what do we suggest taking if she tests positive? So Anna, potentially you may actually still be able to take Paxlovid. It depends. I'd have to take a look at exactly what you're taking for the antiphospholipid. A lot of times they're able to just cut the dose in half for a couple of days, which is usually fine while you take the Paxlovid. But if you want, we can take this offline and discuss further.
Something else can be done if we can, because of the Xarelto. I'm talking in general, not just only in this particular situation. Sometimes we can use low molecular injection, which will give you good protection, like the anticoagulation, but it will allow you to take the Paxlovid if it's really a necessity for you to take this medication. So there is always a solution. Just talk to your lupus doctor.
Another question, will the fourth dose or booster provide protection against Omicron strains, especially the new strains?
I mean, it's a tough question. I don't think we have data yet, but what we have seen so far that, and you can all agree on this, that the severity of the symptoms has improved over time. The number of hospital admission and patients who are running into a lot of complication has changed over time compared to almost 3 years ago when we started. So there is no doubt that the vaccine has helped. And the whole idea from the vaccine, and we always get this question, I took the vaccine and I'm still getting an infection. The vaccine will not prevent you from getting an infection. It might still happen, but the whole idea is to prevent you from getting into hospital, in ICU, intubation, and nobody wants outcome deaths. So that's really the purpose of the vaccine. Now, until we have solid data regarding the new variant, I would still recommend you getting the vaccine, better probably than nothing. Hopefully down the road, it's going to be like the flu. They're going to keep updating what we have, this vaccine, and developing new one to cover the new seasonal COVID. I don't think we're going to have the flu and the COVID now.
Yeah, that kind of brings us to our next question, which was, at what point is it safe for someone on a high dose of Cellcept to go back to the new normal? And how is it possible if you're not really building antibodies to the vaccine?
Okay, so let's correct here. You are right. Building antibodies. Okay, remember we said you're all gonna build antibodies, but the number is lower with the first vaccine. This is why we recommend the second and the third. And we have seen there are studies, I didn't show you here, but the response really gets very well and very good response once you reach to the second and the third. So you are protected.
Yes.
Nathalie, you want to add something?
Yeah, no, I agree. I mean, I think we've all kind of come to the conclusion that COVID is here to stay. It's not something that's going to disappear, unfortunately. And so I think it's important that we do kind of move on and try and figure out how we can all live with this. And like Dr. Touma said, I think we'll just all continue with vaccines and new treatments that come out. And again, you know, still very, very important to get the flu vaccine this year, to get the Prevnar and pneumonia vaccines if you can and are able to. And of course, we always promote Shingrix, which is the vaccine for herpes as well, or shingles.
Shingles, yes.
Just on a side note.
Yes, no, it's very important. And we know we've done, even at our center, we see recently published about this, and we know shingles, it's very common among lupus patients, particularly at a young age, even compared to the general population, because of the immunosuppressant and the prednisone. And we did see, particularly among patients who are on Salsapt or Myfortic, probably more than others. And again, maybe because it's a more severe immunosuppressant compared to Imuran and methotrexate.
Is Shingrix needed more than once?
Yes.
No, I think, can you get it twice?
Yes, Shingrix you need it. Shingrix is the GSK one, which
right.
It's a good one because it's not a live vaccine. And the beautiful part, in the past, we couldn't recommend this for lupus patients because they have to stop prednisone and methotrexate, and it's impossible, or any immunosuppressant. But with Shingrix, you don't have to do this, and it's two actually. The only something not good about it is that it costs a lot. It's an expensive vaccine, unless I think after the age of 65, it's covered for free.
I think, Paulette, if you need it more than once, I think it covers you for a certain amount of years, kind of similar to the way that you get like the TB vaccine and the Pneumovax you have to get every couple of years as well. So check, just because off the top of my head, I don't know and I can't remember, but check with your family doctor when you should receive it again.
Oh, I see the question. I thought that it's actually 2 injections when you receive it first time, but do you need it down the road? I don't think so. No, I haven't heard.
Sure. I can't recall. I feel like no, but double check just in case.
Yes, exactly.
Someone says, I took Paxlovid. Joanne Barilla says, I took Paxlovid in April. If I get COVID again, will I be able to take Paxlovid again? I'm up to date on vaccines where a mask can only go out for the essentials. I don't see any reason why not. Sure.
Yes, sure. It's like antibiotics. When we need them, we take them.
And any COVID vaccine expected in the fall. Are we talking about a 5th vaccine here, June? I haven't heard anything about 5th vaccines.
I mean, I haven't heard yet, but people at least who didn't get to the 4th, we should get the vaccine, and it's gonna come at the same time with the flu. Yeah. Maybe down the road, I don't know if they're gonna combine them both together this year. I have no idea yet. They might start putting together the flu and the COVID together.
Yeah, a couple of years ago, I did run a bit of a flu vaccine clinic along with our lupus clinics, where I was giving a flu vaccine if you came in for your appointment. So we're hoping to do that again. Stay tuned. We'll let you guys know. I'm over 70 years of age, diagnosed with lupus a few months ago. I've had my 3 COVID shots prior to my diagnosis with no side effects, and now I'm on Plaquenil. If I take the 4th booster, can I assume my chances of side effects will increase? I don't think so.
No.
I don't think so.
No, you should be fine. If you haven't had any reaction, any adverse event to the first 3, then that's good.
Yeah. Plaquenil is quite benign, so I think you should be fine, Annette. When are we learning to live with COVID and being immunocompromised? Is masking still super important and staying away from those who are sick?
Yeah.
I would say, I mean, I don't know. I don't think now that this is any different than the flu or viral illnesses that were going around or any of these things. You just have to continue to be very careful. Mm-hmm. I mean, masking or not masking, we've seen that the virus just spreads no matter what. So is masking helpful? Maybe yes, but I don't know that it's going to prevent it altogether.
Yes, and it will help more if yourself and other people are masking, because if they're not masking, probably then it defeats a little bit the purpose. But again, if it makes you feel better and safer, it's okay. Do whatever makes you feel better, bottom line.
Absolutely. How long do we have, Sandra? Till 8?
Well, we have till 8. I don't see any other questions right now, but this is a little bit out of, this was brought up Dr. Touma or Nathalie, I'm not sure if you've heard, shortage of methotrexate in Canada. Apparently there's been some articles regarding shortage of that, probably more so across the border. Have you heard anything at our end?
Not
I
yet, you
haven't.
know. Usually we get notification from the OMA, the Ontario,
Yeah.
Okay.
or even
Okay.
yeah, no, haven't.
So it might be something more across the border. Okay, we just had one more question. It's okay, so is it safe to get Shingrix with COVID vaccine, or should it be spaced out? Was that okay?
Yeah, that's a new
That was
question.
answered before. Okay, so yeah, so can you answer that one as well, please?
Sure. Space them, I would say, because always any vaccine can give you adverse event. Can you imagine if you do two and you get side effects from both? Why do you want to deal with this? Just space them, for sure, space them.
Okay.
Yeah.
Okay.
Agreed.
Okay, I don't see any other questions, but if there's something, of course you have Lupus, sorry, not Lupus, you have Nathalie's email that we typed in earlier, which is lupus.nurse@uhn.ca. So please, she's very open to receiving your email like she mentioned. So we do thank you for that, Nathalie. I'm sure there are people who maybe is not member of the Lupus Clinic. Are you okay with those emails as well coming into you, Nathalie?
Yeah, absolutely.
Perfect.
I get consulted across the globe.
Okay, so for
no
those
problem.
of you, okay, so that's great to know. So for those of you who are not patients at the Lupus Clinic, if you do have a question, please forward your questions to Nathalie. Okay, did something else? Yeah, we just have, okay, one more came up again. So before I do my formal thank you, can we have answer this last one then?
Yes, how can we get coverage to?
Yeah, so unfortunately, I don't think you can right now. And a lot of times, I know there's a lot of family doctors who are very afraid of giving Shingrix to those who are under the age. Yeah. So if you do come across that, let us know and we'll reassure them that it's important for you to receive the vaccine. But unfortunately, we can't get it covered for now.
Yeah, you know, in rheumatoid arthritis with certain biologic, like Rinvoq, they do provide the vaccine, the Shingrix, for free for patients with rheumatoid arthritis. As you've heard, there is a new biologic. Hopefully, we're waiting to see if it's going to get approved or covered or not, anifrolumab. And in the drug trial, we did see a high signal for shingles. So hopefully we're talking with the company as well if they will be able to cover the shingle vaccine. But again, this is going to be only for those patients who will receive this specific medication. Hopefully in the future, we'll have another session to tell you about what's happening, update in the treatment of lupus. A lot of good things, actually.
Yes, and we look forward to that, Dr. Touma. One last question, Nathalie, I'll ask you to answer this because it's regarding, you know, becoming a member, how to get your referral to be able to come to the Lupus Clinic.
So if you have a rheumatologist who's already following you, I mean, we're always, of course, happy to follow. So if you want to get your rheumatologist to reach out to us and be followed here, that's fine. We also will often kind of do tandem visits where if you live farther away from the clinic, we'll see you every 6 months, and then we may have your rheumatologist there see you every 6 months so that we can kind of just make sure that the continuity of care is there as well. But why don't I just type in the chat here our fax number, and if you guys want to send a referral over to see us, by all means.
Okay, thank you so much. Well, I would like to take this moment to thank Dr. Touma again, as well as Nathalie, our lupus nurse, who's awesome, by the way. As you can see, she's always open to help, and her care is just tremendous. So thank you so much for that. So again, Lupus Ontario would like to thank you both for joining us tonight, as well as those of you on the webinar. So tonight was a very important topic, COVID-19. and the treatment regarding the vaccine. Lots of really good information. Again, we will get that information and it will be posted online for you to use as your reference for later on. Maybe, you know, questions will come up and you can use that as a reference to take to your family doctor as well if you're not a member of the Lupus Clinic, because there was some amazing information and a lot, as even with the Q&A part that was presented here tonight. So thank you so much both. I look forward to having you again in the near future. And just for those on the call, our next webinar will be September 20th. And it's a very interesting topic. Nathalie, you mentioned the vaccine. We'll have Dr. Piquet, who will be doing a presentation on pregnancy and lupus. And it should be a really very important topic. We haven't really had any that discussion in depth. And we do have a number of young members who I think is going to find it very interesting. So please join us September 20th for pregnancy in lupus. And again, thank you all for joining us tonight. We do appreciate you taking your time out of this summer evening to spend with us, but I hope you learn as much as I did tonight. Thank you so much. We look forward to seeing you in September at the next webinar.
Thanks, Sandra.
Bye-bye.